So the next presentation is a comparative analysis of the single versus multiple laparoscopic procedures in the same setting, a rare study. And it will be presented by Dr. Nanda Jambunath. Nanda Jambunath, please welcome you to dais.
Yes, start. Good morning, one and all. I'm Dr. Nanda. I'm currently pursuing my minimal invasive surgery training in gynecology in Bangalore under Best Institute. And I thank the organizing committee for providing me this opportunity to present my case, which is a comparative analysis of single versus multiple laparoscopy procedure in the same setting, which is quite an uncommon study. I'll be talking through the introduction of the topic and then study details and then ending with some literature review. It's not moving ahead. The slides are not moving ahead. Sorry. To begin with, I would refer this era of ongoing medical advancement as a blessing in disguise. We know that with improved medical care, the human lifespan is definitely increased, which aids in epidemic changes. Now, along with faulty lifestyle habits, there is increased incidence of medical as well as surgical conditions, and hence we've noted that there is rise in combined laparoscopic procedures. Our center excels in both laparoscopic surgical as well as gynecological procedures, and hence we decided to perform this study. I signify this study uncommon as I have found very few studies where both combined laparoscopically gynec as well as surgical studies were seen. The aim of our study remained to compare and evaluate intraoperative and postoperative outcomes in single versus multiple procedure groups, and the objective remained to see if laparoscopy still remains consistently advantageous regardless of the number of procedures performed. The methodology was a retrospective observational comparative analysis of 100 women, which was performed in, women were recruited who already had surgeries in 3 years of duration, which was from Jan 2022 to January 2025 at AV Arka hospitals at Bangalore. Women were categorized into 50 in each group. We compared various parameters like operative time, estimated blood loss, intraoperative complications, and postoperative analgesia requirement, and finally inpatient hospital stay duration. We made a thorough note of pre-existing comorbidities, and we looked into if they were optimized preoperatively. So like I said, the group one actually included women who underwent both surgical as well as gynecological cases, and the gynecology cases were hysterectomy, myomectomy, cystectomy, cystostomy, hysterolaparoscopy, hysteroscopies, and tubal sterilization, while the surgical cases include cholecystectomy, umbilical hernia repairs, appendicectomy, and abdominal wall reconstruction with URS and DJ stenting. The group which consisted only gynecological surgeries were hysterectomy, myomectomy, adenomyomectomy, pelvic lymphadenectomy, and hysterolaparoscopy with superficial fulguration. Now, these women also underwent some non-gynec procedures, but they were not laparoscopy, so we had not considered in the study. The group 1 had further subdivided into only laparoscopy and laparoscopy plus open. The only laparoscopy group, when we look into, the most common incident surgery was the lap chole, which was about 64%, and hysterectomy, which was 54%. Umbilical hernia was almost in 36% of patients, followed by hysteroscopy, diagnostic hysterolab, sterilization, and the last, the myomectomy. When we look into the combination, the most combination performed was hysterectomy with hernia, and the next was hysterectomy with lap chole, and then to follow with sterilization operation with other surgical procedures. There were also procedures wherein there was more than 3 procedures conducted, and those accounted to about 9 out of the 50. Coming to the group which had laparoscopy plus open, now this I could take that this is one of the limitation of my group, because the umbilical hernia repair in 8 of the patients were done open. However, because they were into abdominal surgery itself, we still included in the group 1. When we analyzed the age intervals of all the patients recruited in the study, we found that group 1, which was the multiple surgery group, the advanced age of women was quite significant compared to group 2. However, we found that there was no statistical significance because their chi-square value remained non-significant. We then compared the associated pre-existing comorbidities, which found that again group 1, which is the multiple group, had increased associated comorbidities compared to group 2. However, the p-values of hypertension, diabetes, hypothyroid and others when analyzed into advanced statistical chi-square values were again non-significant. We then looked into the individual parameters, which is the operative time. It was found that the largest amount of women actually fell into category where the duration of hours was between 2 and up to 3 hours. Again, it remained non-statistically significant between both the groups. When we looked into estimated blood loss, most of the women fell in less than 50 ml. We looked into the number of pain relief requirement. It was found that though the numbers are saying that the number of painkillers required was more in group 1, which is multiple surgeries, when we put into advanced statistical significance, there was no significant. The complication rate also looked into that group 1 had complications 3, which is multiple surgery, and group 2 had complication 5, which is single study, which also said there was no significance. I'll quickly take another 1 minute. So the inpatient stay was finally compared, which said that there was no significant difference in both the groups. And the final result said similar complication and post-operative rate in 2 groups. There was no still statistical significance in any of the parameters. There was a note that increase in multiple surgeries did have increased operative time, but finally there was no significant. To conclude, multidisciplinary team involvement with effective communication leads to optimal patient results in multi-organ or multiple surgeries. I would also highlight the importance of customization of port placement, which aided flexibility in performing multiple procedures in a single patient. Even though we shared the post, the efficacy was quite good. To support the literature, it goes in accordance with my study. There were a couple of studies, 2 of them similar to me, but they hadn't really compared between 2 groups. It was just a study which evaluated multiple surgeries in a patient. One was in 2003 in Delhi, and the other one is 2015, which was performed in China. And the other 2 studies which I have quoted here are, it shows about this splenectomy and gallbladder. End note, in accordance with my study results and literature review, I end my talk referring medical advancement obviously is not a blessing in disguise, but with the laparoscopy advancement, it's a real blessing, which assures improved quality care post-operatively, and laparoscopy having similar recovery curves despite multiple surgeries being performed. Thank you.
Nanda, it was a very good presentation in a very short time. A very good presentation in a very short time, and in today's world, when we are doing most of the surgeries laparoscopically, and patient come with multiple problems. Okay, only thing that we have to keep in mind is that as of there are 2 types of surgeries: reconstructive and destructive. So destructive surgeries, they can be done together. There is no harm. But destructive surgeries plus the reconstructive surgeries, so there, I think there comes the problem. Because if you are placing any mesh or anything, so then if, the chances of infection will be more, yeah.
Yes, I totally agree that, sir. When we place an implant, concomitant surgeries according to the guidelines, I think we avoid doing that. I did look into the literature review where one study, again, an implant was placed for hernia and the outcomes remained similar. And even in our institute, we performed, which I wouldn't really go against the guideline, but outcomes were quite okay. So we just thought of presenting and seeing how it goes.